Welcome back. This is part 2 of 3 in the lecture on quantitative research. In this lecture, we're going to be talking a little bit about the different types of research designs and specifically focus in on experimental designs. So it's fairly common when we're thinking about healthcare research to say that this health condition is caused by this infection, or this drug caused someone to stop experiencing pain, for example. But really, when you think about causation, there's a fair number of different criteria that you need to go through in order to really demonstrate that one thing causes another. And here's just one example of these criteria that have been put forward. This is put forward by Austin Bradford Hill and is one of the more famous criteria demonstrating causation. All right, so what is the first criteria? So this would be temporal relationship. So the idea here is that whatever you're studying, say a certain bacteria, that someone gets infected by that bacteria before they develop disease. If they're getting infected afterwards, then it's suggesting that that disease is probably not related to that infection. Another is strength. So strength is demonstrating that there actually is a relationship between, say, having that bacteria and having the disease, and that correlation is fairly powerful. If it's a very weak correlation, it may suggest that there may be other factors that are causing it and that this actually isn't causative. So the stronger the relationship, the better for demonstrating this causal effect. Again, this is not necessarily required, but it is a component that one would use in determining causation. Another is dose response. So having more of an exposure leads to a greater degree of risk for that disease. So if you have, for example, more likelihood of encountering that bacteria, that your risk of developing that disease will go up as compared to people who had less exposure to that bacteria, or perhaps had less of that bacteria in their bloodstream, for example. All right. 4 is the idea of consistency. So that you can study these interactions using a number of different methodologies. And when you see it popping up using a number of different approaches, this provides additional support that there actually is a relationship between the bacteria and the disease, or what other factors you're trying to examine that causal relationship for. Number 5 is plausibility. And this is the idea that your relationship should make some sense biologically. So if you're talking about a bacteria in this relationship to disease, what do we know about how that bacteria affects cells so that it might actually cause this disease state, or perhaps organs, or understand more about the biological history of that disease? Okay, 6. So another thing is that there's an expectation that researchers have really explored other possible explanations for why this might happen. So it's one thing to say that this bacteria causes this disease, but if we haven't really looked at other conditions, perhaps toxins in the environment or social behaviors that maybe cause that disease too, then, or say things that people do that are correlated with being associated with that, encountering that bacteria, then it may be that there's other things that may be causing that disease that just happen to be correlated with the presence of that bacteria. 7 is being able to do an experiment, and that's actually what we're going to talk about a little bit more in this lecture. But the idea here is that the condition can actually be altered by having different treatment groups. So, for example, you can take a group of people and expose them to a bacteria, and then take another group of people and don't expose them to the bacteria, and you can then see whether or not that disease occurs. So this usually isn't really possible for diseases that are extremely severe, but for things like flus, for example, common cold, this is actually fairly frequently done. Another criteria that's brought up is the idea of specificity. So this is the idea that a single bacteria is causing a single disease outcome. When you have many different dependent variables, or a bacteria is causing 5 different disease outcomes, that is that is a possibility, but it does suggest that there may be a much more complex situation going on where the causation is not entirely related to that bacteria. Again, this is not required because there are some bacteria that cause many different diseases, for example, and it's only due to that bacteria. But it is an indicator of the level of evidence and the strength of support. Another is the idea of coherence, and that this proposed causal relationship actually is compatible with what we currently know about theories and knowledge related to that disease and how diseases occur. Now, there are actually a number of different study designs that can be used to begin fleshing out our knowledge about how different conditions may cause different health impacts. So these are laid out in order of generally the stronger to the least strong approaches to be used. Now, again, that doesn't invalidate the less powerful approaches. It just says that there are differing levels of evidence. So the first level of evidence is experimental designs, and that's what we're going to be talking about more in this part of the lecture. In this part of the lecture, in this study design, you'd expect there to be variation in the treatment. So that's manipulation of whether someone gets, say, a drug or doesn't get a drug. You also would expect that there would be a control group, that you would compare the group that has received the drug to in order to see whether there's an effect. You'd also expect that there would be randomization, where people would be assigned to these different groups without any previous knowledge or determination of whether they get it. So it would be, they really could wind up in either group, and this cuts down on selection bias and other factors, which we'll discuss more. There's also quasi-experimental research designs, and this is similar to an experimental design, except it may lack components to it. So it may lack either randomization or having a control group. So this is somewhat less strong in terms of a study design, but it can also still produce really interesting results. There's also what are called non-experimental designs, and these are studies that look at relationships between factors as they exist naturally. So, for example, you can't actually assign people to either become smokers or not become smokers. That's something that we can't do because we know that it's bad for people to smoke. So you can't tell people you're going to smoke for the next year and we're going to see whether or not you die of lung cancer. So what you have to do is, in this case, is you have to understand the relationships as they naturally exist. And these approaches are called non-experimental approaches. And they can also be really powerful for understanding things that, for example, toxins in the environment, to see how they relate to various diseases. Finally, there's also what are called descriptive designs, and these are usually early phase research which attempts to describe a phenomenon. And this is very powerful for beginning to essentially understanding what's going on in the context of a certain disease. All right, so let's turn our attention to experimental research. So experimental designs really have the virtue that they are probably one of the best designs for exploring cause and effect relationships. So in order for this to occur, there has to be a reasonable identification of a cause and the identification of a potential relationship between that cause and an outcome. So there are a number of issues that we've already addressed in previous lectures that would be considered in this. One of the major ones being, can you actually manipulate the variables that you'd be looking at in the study? So what are the defining factors of experimental research? Well, you'd expect that it'd be possible to manipulate the independent variable, say give someone a drug or not give someone a drug. Secondly, you'd expect that there would be a control group that you'd compare your treatment group to. And thirdly, you'd expect that there'd be randomization within the trial so that individuals could either go to the treatment or the control group. We'll discuss more about these different components in the So manipulation as a concept really gets to what we think about when we think about an experiment. It's the idea that you're varying something and seeing whether or not that makes an impact on your outcome. Specifically, you're going to change the independent variable that you're interested in and that you think may result in a specific outcome. So generally speaking, you would either give someone a treatment or not. You might teach people in a certain way in one intervention and then not teach them in another way in another arm of the intervention. You might give someone a pill, a medication of some sort, or you might do something to change an environment. For example, say seeing whether piping in music actually helps calm people down in certain situations. So that's something you can change in their clinical environment. So you would manipulate this variable, and then you'd see whether or not that changes the dependent variable that you are measuring. So another element to experimental trials is really trying to have a high degree of control. This helps researchers to determine whether or not the relationship that they see between an independent variable and a dependent variable is actually real, and it helps them to rule out other possible explanations for why there might be this connection. So one way to do this is to use what's called a control group. The control group is essentially a comparison group to your treatment group. And this group should be as similar as possible to the treatment group, except for the fact that it did not receive that treatment. Now, sometimes this is going to actually be a challenge if it's really believed that this treatment may have an effect. So there's some trouble with this early on in AIDS research, where they were trying to do randomized control trials with AZT, and people from the control group were realizing that they weren't actually getting the treatment, and through negotiations with clinicians or with other people in the trial, they were able to get AZT, and that affects your ability to compare between the control group and your trial group. So really you need to pay close attention to make sure that your protocols are being adhered to and that they follow the standardized approach. You can also help determine this by doing pre and post measures to see where the participants in the study are at during the study, and to see whether or not there's substantial differences between the control group and All right. So the final element to experimental designs is randomization. And this is essentially the idea that a person entering into an experimental study could either wind up in the control group or the treatment group, and that this is purely random. So, for example, you can do this a number of different ways, but one way would be, you flip a coin, and someone who gets heads would go into the treatment group, and someone who gets tails would go into the control group. Now, this can be done for individuals, or it could be done, say, for units. So if you're studying whether a certain approach to providing care for a patient by changing this protocol, if this actually has an impact on health outcomes, you could have some units do this in some hospitals and other units not do it in other hospitals, and you can randomly assign them as to whether or not they're going to carry out this new protocol. Now, why is randomization important? Well, everybody who comes into a study is going to be somewhat different. And what you want to make sure is that the people who are in your control group are not substantially different than people in your treatment group, especially as it relates to these extraneous variables that we know of that might influence your health outcome. So if your outcome is, for example, body weight, and you have people who are taller winding up in the treatment group and people who are shorter. So we're going to talk a little bit about several different experimental designs that one could use. And in this, we're going to talk about approaches that are somewhat less strong and move to approaches that are the strongest approaches for demonstrating connection between an independent variable and a dependent variable. So let's start off with talking about an after-only experimental design. So here you're going to identify a sample from a population where you take your participants in the study and you randomize them to be in your intervention group or your control group. You then do an assessment afterwards, collect data to see whether or not your intervention had an impact on the outcome that you're interested in. Now this approach is sometimes the best approach when you're looking at an outcome that you can't measure prior to separating people into intervention or control groups. So an example of this would be an outcome like post-operation pain, for example, where it's a fairly severe situation that you can't actually measure prior to doing your intervention. Now, it's somewhat the issue with this approach comes up when you think about something like a educational intervention. So say you're teaching people how to decrease their risk of moving from being pre-diabetic to diabetic. Now, you can separate people out using randomization into an intervention and control group. But what if, by chance, your intervention group just happens to have more people who have a greater degree of knowledge about diabetes than people who are in the control group? Well, then your outcome might be inaccurate. It might just be due to the fact that your randomization, by chance, had unequal distribution. Well, there's an answer to this. This is the traditional randomized control trial, and this addresses the problem that I just mentioned by identifying a population and then doing a baseline survey. So during the baseline survey, you'd collect data that would tell you about all sorts of information related to your intervention that's relevant in terms of your population's knowledge and background and environment, for example. You then have your subjects randomized to the different groups, and you carry out your intervention and compare it to your control group using your post-intervention data. And then when you're looking at whether or not there's an effect, you could then also check and confirm using your baseline data to make sure that the intervention and control group, that, for example, in the example of diabetes education, that the intervention group didn't have substantially more information prior to the study than the control group. So this is a very traditional randomized control trial structure. Now, what is a potential problem with this? Well, what if the process of doing that baseline survey actually resulted in testing effects? Well, there's a fourth way that you can address this. So one way to address this concern is to identify your population and then randomize them into 4 different groups. Now, in this situation, 2 of the groups, you'd actually collect this baseline data and carry out in the same way that you'd expect to carry out a randomized control trial, and that's the 2 groups on the top. For another 2 groups that are on the bottom, you would collect no baseline data, and you would just do the intervention. Now, what this does is this provides confirmation that the initial collection of that baseline data didn't result in a testing effect. And this is probably the strongest approach for doing an experimental study. The problem with it, as one could imagine, is this makes the study pretty big and much more expensive when you're comparing across, having to have enough people in each of these different arms that you'd be able to find statistically significant results. All right, so what are the advantages and disadvantages of experimental designs? Well, first off, these are really the strongest designs for determining whether there's a cause and effect relationship between an independent and dependent variable. So this is usually seen as being essentially the gold standard in scientific research related to health. And so when you see the hierarchy of evidence in the pyramid, randomized control trials typically come out to the top. Now, what are the disadvantages? Well, not all research questions can be easily done in the context of experimentation. So, in some cases, you can't manipulate whether someone has a treatment or not, and sometimes it isn't appropriate to randomize them between two different treatments. Another problem with this is often subject attrition. So in cases, especially when a control group knows that they aren't receiving the treatment, sometimes they're much less motivated to be involved in follow-ups, and you can have many more people dropping out of your control group, and that can affect your data quality. It's also often very difficult to carry out in clinical settings because it requires a lot of management and a lot of control, and this may or may not be easy to carry out in using these strong standardized protocols. There's also many situations where you see the Hawthorne effect popping up, where participants are behaving in certain ways because they believe that it's what the clinicians or researcher wants them to do. And this is especially a problem if the experimental and the control group are treated in a different way. So this concludes the lecture on experimental research designs, and we're going to move on in the part 3 to talk a little bit about other approaches to doing research.